Okay, so we are on live now. Dr. Haytham, please start.
Thank you. Okay, Assalamu alaikum. Good morning, good afternoon, good evening, our guests, our audience and speakers, wherever you are. It is my pleasure to moderate our today's session. And obviously, it is really an interesting one. I'm Dr. Haytham Bashir. I'm the Director of the Public Health Emergency Management Center here at EMPHNET. And as we all follow the recent advances in technology and the use of technology, emergency management in this era, which is characterized by complex and frequent emergencies, actually, including pandemics, conflicts, and natural disasters, it is crucial for public health professionals to update their skills and competencies. Not to mention as example, integrating the artificial intelligence into negotiation strategies, which will offer or actually offers new possibilities, enhance real-time decision-making. Stakeholders engagement and conflict resolution at the same time. There is a high demand for strong institutions that are capable of delivering cutting-edge and relevant public health training. So in this session, we will introduce a new advanced training opportunity, and also we will spotlight on the International Academy of Public Health, IAPH, as a successful model for sustaining public health capacity building in this region and beyond. So I'm honored actually today and really pleased to have two esteemed speakers. I will introduce our first speaker for today, Mr. Claude Borderline, who will be talking to us about the course on AI enhanced negotiation in health emergencies. This course is offered by the Geneva Center for Humanitarian Studies at the University of Geneva in collaboration with EMPHNET. Mr. Claude is a senior lecturer at the Geneva Center of Humanitarian Studies, specifically for advanced course on AI enhanced negotiation in health emergencies. He is a researcher, educator, specialized in complex negotiations. In 2023, he co-founded Frontline Associate, a community of practice dedicated to advancing best practices in complex negotiation and supporting the development of AI tools to assist frontline practitioners. Based also at the Harvard Kennedy School, the School of Public Health, he also teaches negotiation courses and leads training programs through partnership with the Graduate Institute Executive Education Program in Geneva and the Geneva Center for Humanitarian Studies. Additionally, he instructs the climate negotiation at the University of Sherbrooke in Quebec, Canada. And Mr. Claude, now the floor is yours. Looking forward to your presentation. You have 15 minutes and the floor is yours. Thank you.
Dr. Bashir, thank you so much for welcoming me. It's a great pleasure and honor to be with you today. I'm calling in from Canada, and it's a great pleasure to be able to share some elements of how we will be presenting a course in Amman over the coming month. I will share my screen and give you a bit more detail about the upcoming course. So this course has been developed with based on research that is conducted at Harvard University, but it's a close collaboration with University of Geneva Center for Humanitarian Studies, and has been really offered to bring advanced practitioners, people who have experience in negotiation, into the age of artificial intelligence. Okay, so essentially the agenda for this presentation is a short presentation about why this course, how we're going to develop this course together, the structure of the program, and what will come after the program. Why this course? As you know, we are being confronted with increasing challenges on the front line of public health. There is increasing complexity, multiple actors, multiple stakeholders, increasing tensions, and a growing adversity. It is becoming riskier to operate in the public health and health emergency area, which requires us to establish stronger links and stronger dialogue with the parties concerned, while it can be quite intimidating. And the purpose of the course per se is to upgrade people's skills and methods on how to negotiate in health emergency, but now with the addition of artificial intelligence. The learning objective of the course, that is over 5 days, full-time course in Amman, is to equip professionals with practical tools. Okay, this is not a theoretical course. It's not an academic course. It's really a course about practice. It's based on over 10 years of empirical studies of good practices on the front line by negotiators and practitioners, and really offer hands-on learning experience and immersive experience on how to apply these tools in simulation and case studies, and the purpose of which is to encourage a sharing of experience among participants. Participants coming to this course already have experience in negotiation, and we want to open a safe space for these practitioners to share their knowledge, their practice. The features of the course, first of all, is immersive. Okay, we learn by doing, and this is a strong belief on my side with 30 years of experience in negotiation, is that we learn negotiation by doing. So it's very much practice-oriented and develop a skill set. Through the interaction with other practitioners, we hear stories, we hear reflections, and then we share our own, and we absorb these lessons through cases. Is to acquire recognized AI negotiation tools, and I will talk more about that, how AI is currently coming into the practice of negotiation, and we want here to provide a basic understanding of how AI works, how AI can be useful for negotiation, but also what are the risks and limitation of using artificial intelligence in negotiation, and ultimately offer an opportunity for connecting participants with a network of practitioners associated to this practice. For who this course is? Well, essentially it's for humanitarian professionals that works in crisis environment, for crisis negotiators and whatever sorts, can be in climate, migration, other domains, but focusing more in this case on health emergencies, looking into cases of cross-line operations, providing assistance to population in need, vaccination program in conflict areas. And we will have professionals who have experience in negotiating in this environment, sharing a case with participants and encouraging participants to reflect and learn from each other in this situation. What you will learn precisely in this course? Well, first is advanced negotiation planning. You will get a systematic method on how to negotiate under time pressure, under political pressure, how to maintain a systematic, stable way of operating in these difficult relationships. But how to leverage influence in a network of stakeholders. And now this is where artificial intelligence will be very useful, is how to integrate a much larger scope of possibilities of leveraging a positive, constructive dialogue with parties in a negotiation. Crisis management skills. These are difficult circumstances, and there are tools and methods to simplify and build trust and legitimacy and have self-confidence and control in these circumstances. And that we will look into personal skill development, how to maintain the management over stress, over intimidation, really have a hard look at what do we mean by trust, and how we can translate this knowledge in terms of skills. We strongly encourage collaboration and collaborative approaches with other practitioners as a ground, as a bedrock of negotiation on the front line. We're not here to win in negotiation. We're here to build relationships. And that will be a strong component of the teaching. Real world application. All cases are from current practice. This is not a theoretical course. This is not an academic course. It's a course where we look into cases coming from practice and learning from these practitioners. And ultimately, bring this into the world of AI. How AI can help us process information into consistent, systematic approaches for this negotiation. A word about AI. Participant will model an AI assistant and will learn how to use the AI models, not simply in a generative way, not really knowing how to do it, but to do it in an effective and responsible way. And this is based on research at the Harvard School of Engineering and Applied Science, as well as the Massachusetts Institute of Technology, how to bring participants really up to a level of proficiency and fluency in using AI in a responsible manner. Because let's be clear, the race is on. AI is coming into negotiation. And as we progress, clearly, negotiators with AI will replace negotiators without AI. It's a matter of time, and it's a matter of the efforts of participants to really acquire the skills to be able to drive this very powerful technology and don't make an accident, okay? So we will focus on these points of going beyond efficiency. We think currently the use of AI is quite limited, fragmented, very focused on automatization and efficiency. We will help participants to go beyond that and really think strategically how this technology will influence them. Currently, there's distrust into these technology, and we'll be talking about that. Myself, I'm not enthusiastic. There are serious risks associated to the use of the technology. The technology is being used. Is it by participants in their basement? Is it by government? So people need to know how to build their ability without to be overwhelmed by information, because large language models produce a lot of data, a lot of text, can quickly overwhelm organization. And the purpose of this training is to help people see how to do it better, particularly moving beyond efficiency, looking into analytical tools, developing really their own personal AI assistant and being able to craft it the way they see fit, and really regain control over that technology so it makes sense and it can become more transformative. Of course, in this short presentation, we cannot go beyond this introduction, but it's to say this is the beginning of a pathway for participants to go beyond the course. First, by joining a community of practice for those who want, and continue to develop their negotiation skill, their ability to engage in difficult environments. It's a craft, and as any craft, being in health, architecture, engineer, or negotiation, it's a lifelong journey of exchange and learning from others. And collaborate, we offer, through partners, we offer monthly simulation for people to keep up with their skills and develop their ability to handle different types of health emergencies. Join this AI negotiation challenge, which I'll say a word now, and be part of a global community of negotiators with AI. A word about the AI Global Negotiation Challenge. It will take place next year. We just did one now. There will be the next one on 2nd and 3rd of May 2026. It's a large online competition where there's 50 to 60 teams from around the world who come to look into a simulated crisis where people can come and further develop together their skills in using artificial intelligence in negotiation. These are some of the codes that you can grab, especially the one for the course in Amman, 13th to the 17th of July. There's also a course in Istanbul hosted by the Kizilay. You can also grab the code there. this is what I wanted to say, and I'm very pleased and looking forward to meet with participants in Amman in a month. So I will stop here. Back to you.
Thank you so much, Claude. This is really interesting, and I think now we have the appetite to not only to ask questions, but to make sure to attend. And please, our audience and participants, if you have any questions, please drop the Q&A box. You can find the below bar. This will really help me because there are so many messages in the chat. So please use the Q&A and we will answer all those questions with Mr. Claude after our second presentation. So thank you again, Claude, and move for our next presentation. And it is my pleasure to introduce my friend and colleague, Professor Yusuf. I think is well known here in the region. Professor Yusuf, who will be talking about the experience and the International Academy of Public Health, IAPH. So Professor Yusuf is a professor for epidemiology and biostatistics at the Faculty of Medicine, Jordan University of Science and Technology, known as JUST. And he also support our work by leading the Center of Excellence for Applied Epidemiology here at EMPHNET. Dr. Yusuf has a master's degree in public health from Tulane University in the US, epidemiology and biostatistics at JUST, and a medical degree, a doctorate degree in biostatistics from Tulane, as well as a master in medical education. Professor Yusuf is a fellow faculty of public health the Royal College of Physicians, UK. His areas of expertise, of course, epidemiology, biostatistics, NCDs, and many other fields. I don't have the time actually to mention all his bio, just to let you know that he has over 650 published scientific papers in peer-reviewed journal. So Professor Yusuf, we are waiting to know more about IAPH, and you have 15 minutes to go. Thank you.
Thank you, Dr. Bashir. Assalamu alaikum. Good morning, good afternoon, and good evening, everyone. It's really great pleasure to join you. Just a brief correction, I published more than 850 papers, not 600. So you omitted 200, Dr. Haytham. Today, actually, I'd like to utilize this opportunity to introduce International Academy of Public Health, what's known as IAPH. You heard about IAPH and its nice logo, so I will proceed to my next slide to explain what's IAPH. IAPH is really a leading educational institution that is specialized in a professionally oriented and practice-based public health professional education in the Eastern Mediterranean region and beyond. IAPH is hosted and empowered by EMPHNET, the Eastern Mediterranean Public Health Network, and I can admit that we succeeded from the beginning in IAPH because we relied on the legacy of EMPHNET. IAPH continued to receive and to be counseled and advised by top leaders in public health from around all the world. Why IAPH exists? Because there is a dire need for continuous professional training and specialized skill development in specialized disciplines of public health, not in public health science in general, specialized discipline in public health. IAPH came to bridge the gap between academia and academic learning and public health practice. The current gap in public health competences in the region, Eastern Mediterranean region, and basically other regions can benefit from our professional training. We have a set of principles and values that govern our work. We strongly believe in establishing collaboration with multiple partners to achieve a common goal. Just presenting the advanced negotiation skills, it's one of attempt actually to establish collaboration with Geneva University and with Harvard University. We are committed to being responsive to current and emerging needs in the health sector. We adopt a model that we will leave no one behind in public health education. So there is no exclusion to any country or no exclusion to people. People have equal opportunity to attend and enroll our programs. Our vision is clearly stated to attain excellence in public health education and innovation at regional and global spheres. Our goal is to design and deliver quality postgraduate educational programs in different specialized areas of public health to fill the existing and emerging regional gaps. These are our strategic objectives. The first one is to strengthen our institutional capacity as IAPH. Our second strategic objective is to transform public health education towards a credible practice-based model and scaling up public health education programs. And most important is the promoting the professionalization of the public health workforce in the region. IAPH is governed by or is led by a board of directors who is advised by 20 distinguished and top leaders in public health in the region and beyond. The executive director who manages IAPH, is advised or is counseled by 14 members of scientific councils and more than 70 specialty committee members. We developed in different modalities, in different languages, some of them in Arabic, English, and French, more than 150 courses that are clustered and covering 37 programs in 17 field of studies. And I'd like to see these are the 17 areas that we provided training in, because at the beginning, we started believing that public health should be a specialized science, specialized practice. So we have program in public health emergency management. So the one who is graduating from this program might be challenging to lead non-communicable diseases programs, as an example. That's why we established another program in the area of NCDs. We have a program in primary health care. And the good thing that we are offering these programs with reputable universities and academic institutions. Public health emergency management is offered jointly with Minneapolis University. For example, environmental health is offered jointly with Ajloun University in the north of Jordan. And now we will announce actually very soon a professional master program and a professional diploma in primary health care, utilizing family health team approach and utilizing universal health coverage principles, where this program, where essential public health functions are integrated in primary health care. We have other fields, as you see on this nice tree. We have different areas: biosafety in public health laboratory, health economics, global health, EMR, health informatics. And you can realize, that the region, there is a gap and severe shortage in specialized health professionals in these areas. That's why IAPH exists. We started with a professional diploma in environmental health program, and the other one that we offered is executive professional master program in public health emergency. The good thing that both programs are really well received. When at the beginning of this year, when we started offering the two programs, we aimed at one cohort. Now, in the next week, we are implementing the 6th cohort of master program and the 5th cohort. Now there are more than 120 applicants for the 6th cohort that will convene by the end of this month. In addition, we also offer courses. For example, we have health research studies courses jointly with Jordan University of Science and Technology, which is a leading and highly ranked institution in the region. This is how we structure our program. This is for a field of study. Think, for example, of public health emergency management. We have divided to 3 sub-programs. Each sub-program consists of 5 courses ended with practice-based learning. For the online format, actually, we are implementing a different modality for practice-based. We are offering assignment that mimic real-life public health practice. But the other version now that we are working on in public health emergency management, there will be field training where trainees will be positioned in different areas or in different fields. The same thing for sub-program. The 3 sub-programs form one program. So courses can be taken within 1 or 2 weeks. Since we are implementing online, we are really flexible with this, and this is the nice about IAPH. The one who finished the course will earn a successful completion certificate. We have a technical diploma of 3 months. It's a narrow and task-oriented program. And we have a 9-month program in form of professional diploma. It's broad and competency and role-oriented program. And finally, we have 1-year executive program. IAPH is really now well recognized, is accredited by accreditation services for international schools, colleges, and universities. It's known as EMPHNET. All courses and programs of IAPH are accredited by EMPHNET. Recently, we received this recognition from CPD, and we are now a member of CPD UK, and we adhere to standards of professional learning. We have also national accreditation, and this is for Jordan, and we are seeking accreditation in each country in the region. So our program or our learning management system is accredited by Higher Health Council. 1 or 2 programs are accredited by the technical and vocational skills. Jordanian Nursing Council, Jordanian Medical Council also accredited many of our courses. We have real partnership with different institutions, University of Leeds, Faculty of Public Health, Emory University, and other universities in the region in Jordan, Yemen, Egypt, Iraq, and everywhere. And we are looking forward. Actually, we have established collaboration with the University of Geneva. We are working very hard with Dr. Carl, who is a pioneer public health professionals. I know that he's joining us. He might be smiling now. Partnership and membership. We have really partners with the Association of Arab Universities, Arab Board for Health Specialization. Now we have our course in the research methodology is now accredited and endorsed by the Arab Board for Health Specialization. Those who are applying for this board, they have to take a course on research methodology, and we recommend really taking our course that is accredited by the same board. We are members of IAMPHI and ASFIR. These are the abbreviation for International Association of National Public Health Institutes, Association for School of Public Health in the European region. Plus, we have also other collaboration with CDC Africa and with the Public Health Authority in Saudi Arabia and others. So I will not mention all partners. So each course, actually, that is 1 or 2 weeks, is equivalent to 30 learning hours, can be taken during 1 or 2 weeks, equivalent to 25 credit hours, CPD, sorry, points, and equivalent to 20 credit hours. So if in the future you want to transfer the course to an academic, this is equivalent to 1 credit hour. The same thing, these are for our programs and for diploma. This is an example. Now, since we started, we have more than 3,700 registrants. 650, even more than this, are actually trained from the whole region, from more than 78 countries, as you see here, the distribution. Our training approaches, we are using different modalities, self-based training or like distance or online training. Also, we offer a class training and also blended training. We are showing a flexibility and utilizing our learning management system, which is really a unique one, and it fits very well. Actually, it fits very well for our programs in terms of interactivity, integration of simulations, case studies, and etc. We rely on a pool of instructors and mentors in different subject matter experts. For each area, we have, as I mentioned at the beginning, we have more than 70 members in specialty committees. But basically, we have a long database of experts worldwide who are supporting implementation of our programs. Everyone can join. The one who is interested, public health is for all, for physicians, pharmacists, dentists, nurses. Everyone who is interested can apply, to pursue a public health career. Public health workforce, health professionals, and the Ministry of Health in academic institutions, public health researchers, all have the opportunity to join our program. Training fees, again, what I mentioned, that no one is excluded. So in some programs, the fees are really minimal. And also we are offering scholarships. We rely on our partners. For example, WHO supported more than 15 persons to enroll in environmental health. For example, another institution, Jadur in Palestine, supported many people to enroll in environmental health and public health emergency. So we are also establishing partnerships who can provide support, and people can self-enroll in these programs and pay the fees that are affordable. What does the future? We have strategized our work as the region for most online learning platform for public health sector professionals. We are working hard to achieve our vision, provide more programs in the highly demanded areas of public health. Now, we are currently working with Ras Al Khaimah as an example in United Arab Emirates to establish 2 programs, one in public health and one is epidemiology in a practice, where we integrated advanced technologies. So we have, for example, some courses in AI and machine learning. So we are utilizing and adapting new technologies to offer to our trainees. I don't want to talk too much about this, but you can visit our programs, and to learn more just simply by scanning these codes for the executive professional master, professional diploma in environmental health. Thank you so much. Thank you. These are our emails and websites, phone numbers. Don't hesitate to communicate with us using take snapshot of these emails and phone numbers. Thank you. Thank you so much.
Thank you. Thank you so much, Professor Yusuf. And I give you back your 250 publications.
Thank
you. I'm really proud seeing the progress made so far with the International Academy of Public Health. I was part of it when it was first established in 2000. 21, the official establishment, and I think since then many advancements are there. So, Claude, back to you, and thank you. I can see that you responded to almost all questions in the Q&A box, but as I believe that many of our audience using their phones or driving or while listening, be very appreciate if you can briefly describe to us how to apply for this course, where, when, and I see, certificates, etc. The same answer that you provided. And then I have another question that I will put later. Yes, please.
Very good. Thank you very much. Well, there is a website to get more information and to apply. That's the website that goes with the University of Geneva. I will share the link here. You will also find on LinkedIn, if you look for the Geneva Center for Humanitarian Studies, you will find also all the material of courses for the summer. You'll find also all the links there. So if you cannot capture these QR code with your phone, you can easily go on LinkedIn and you also find the material there, or on the website of the Geneva Center of Humanitarian Studies. So there is a certificate. So this course is offered as part of the executive education of the University of Geneva. So participants who complete the course of 5 days, so it's a demanding course, will get 2 credits under the ECTS system, the European Credit Transfer System. So it is a recognized course by the University of Geneva. There's no exam. This is a practical course. There are exercises that you need to complete, but there's not a final exam associated to it. We consider that those who have invested the time and energy in this course deserve the certification. So I underline here, it's a demanding course. It's not a course you can do on the side. You have to invest that week. It's a transformative course. It will bring you to a level of advanced fluency in frontline negotiation, as well as of using artificial intelligence. So it will require your full attention for an entire week, for which you get a certificate. There is, for those who want to push further the development of their ability, they can stay connected with the Frontline Associate Community of Practice. And there's further opportunity to develop your AI capability, craft your own models, participate into simulation, and ultimately join the AI Negotiation Challenge hosted by Harvard University in May 2026. So you can grab this and we'll be happy to further provide links to the registration process.
Perfect. And may I kindly ask our colleagues, Ammar, Mais, if you can email some of those materials and links to our audience after the webinar, that will also be useful. And for going to Professor Yusuf, just Claude, I have one more question from the Q&A. At least 2 or 3 questions are about how practically people can apply this AI in the field, while it is somehow linked to use of internet, sophisticated technology, advanced equipment, smartphone, etc. So is it a question that you can explain now or to be revealed during the workshop?
Well, very, very clearly, we are a low-tech access world. When we work in health emergencies, humanitarian crisis, or conflict zone, we have a limited access to the internet. So this is very much taken into account. The negotiation course doesn't require, the tools presented don't require access to the internet. You are on your own, you develop your skills and you build trust with your counterpart. You don't need AI, you don't need internet. We are here to promote a human to human negotiation, okay? Now, the AI becomes of relevance before and after that negotiation. Before in terms of planning, understanding complex environment, adversarial relationship, be able to plan and prepare that negotiation as a collaborative tool within a team and within an organization, where most often there is internet. Or after the negotiation, when it's time to debrief and learn from what happened during the negotiation, here again, there is internet in most cases, back to the office, back to a reflection with your colleagues of what we have learned during this negotiation. So the course is more than AI. The course is an advanced course in frontline negotiation. AI is there to support and assist before and after the negotiation in analyzing the situation.
Thank you. So AI will not replace the human negotiator.
Oh my God, no, we don't want the AI to replace the human negotiator. Humanitarian and health negotiation is about trust, okay?
Yes.
And I can guarantee you, you should not trust a machine, okay? This has to be stated. AI is an assistant to a human-to-human negotiation, especially where the situation becomes very tense, intimidating, and highly complex. AI can offer a tremendous support in simplifying and de-emotionalizing a situation by having their capability to generate possible options to help us think critically about our agenda and then prepare a plan for the negotiation.
Thank you. Thank you. We'll come back to you later, but Yusuf, I have two questions, if you like to answer both at once. First question, does IAPH, considering its working modality, developing customized courses for interested agencies, like, for example, ministries of health, institutes, etc., beyond or beside the courses that you presented to us, if an agency requested a special or a customized course? This is the first question.
Yeah.
Yes,
Let
please.
me answer this question. Yeah,
Yes,
one by
please.
one. Thank you. This is really good question to answer, Dr. Haytham. You know, we are offering standard training programs, courses, diplomas, and master that are based on the best available evidence in the region that fits very well to the whole region. However, we work with organizations to develop customized and country-tailored or even population-tailored programs and courses. We have successful experiences. 2 weeks ago, actually, we worked with UNICEF in Palestine to develop a customized risk communication and community engagement course. You know, the situation in Palestine and in Gaza is really unique. You cannot apply everything to this context. So we worked hard to produce a very interesting and it was really favorable program. We work actually with Saudi Arabia to develop specialized courses that fit. For example, in Saudi Arabia, there is mass gathering. Developing, for example, courses in public health that, you know, fits very well to the mass gathering events. The same thing, we work with Qatar in emergency. We work with WHO to develop specialized courses. We work in Jordan as well as other countries in the region. So we are really pioneers in this area. Not now, long time ago. That's why I said we relied on the legacy of EMPHNET. EMPHNET since the last years, last decade, developing customized programs. Field epidemiology program is an example for EMPHNET programs where it's customized to each country and to each priority area. So the shortcut answer, yes, indeed, we are very willing and very available to provide such type of support and developing such courses and programs.
Thank you, and we really appreciate your support of such courses. I know that you personally were in Palestine 2 weeks ago for this course. So really thank you. The second question also related to IAPH courses and its online modality. Many comments are about the effectiveness of online courses for, especially the target audience are those who are already graduates or employed within their agencies. So what measures does IAPH take to ensure the flexibility of its training modalities to suit all those who are busy, they don't have the time to complete like a 3-month program at once, full time, etc. So please, if you would like to elaborate more.
Sure. Yeah, actually, when we started, implementing our program, the decision was to implement our program to start with in-person program. However, when we did the training needs assessment, we were guided by the participants, the pool of participants from different countries in the region. They mentioned it clearly that we are, busy most of the time during our work. So we cannot travel. We cannot even spare time to go to attend in-person workshops or training courses. What we need is to have an online learning. That's why we switched smartly at the beginning and we started implementing online training. And from the feedback that we receive and continue receiving, we are receiving favorable feedback about the program and its effectiveness. People are really satisfied. Not all people, some people prefer to have in-person, especially who are not employed. But for the employed people, this is the ideal choice. Ideal choice is to go with online learning. My own experience, I can tell you, when I finished my PhD long time ago in USA, I continued my education and enrolled in a medical education program in Suez Canal in collaboration with Maastricht University. It was really distance learning. And it really was very helpful. At that time, I was the Dean Assistant for Faculty of Medicine. And we created a revolution in the curriculum and the medical education at Jordan University of Science and Technology. Also, we have evidence from our research. I can refer people to search for some articles that we showed that online training is not inferior to in-person training. Still, online training is still cost-effective approach. However, now we have the plan to implement in-person training in some selected countries where we have a presence, like, for example, in Egypt, in Iraq, in Yemen, and etc.
Thank you, Dr. Yusuf. And one more question, Kula, about the same point. Is there any plans for you to present or to offer this course as online in the future? And yeah.
Yeah, so this course that is organized in Amman and in Istanbul is on site, but the usual way the courses are delivered are online. Okay, the on-site nature is for the most advanced professional course. These are negotiation course, and as you know, practical exercise, case studies on negotiation are much better conducted on site because they are personal skills. For courses which are more driven toward the use of AI in negotiation, these can be delivered online, and they are mostly delivered online. However, the course that is offered in July is more than AI. It's about the most advanced skills. It's the same course we offer at Harvard University or at the University of Geneva. So it's a very high-level course that people may want to take advantage. We have online courses in different format, also with different degrees of access. Some of them are for free, Some of them a very low fee. The point here, we're building a community of practice that is a global community, and there are evidently different, economics related. Our goal here is to promote a fair and effective and responsible access to AI in negotiation. And for this, you can visit the AI Negotiation Challenge website and stay connected by being part of that community and able to participate to some of these online events. We do offer also online courses with Harvard University, with the Geneva Graduate Institute, but these courses may be too expensive. We would certainly look favorably into an option to have an online course with the Academy of Public Health, for example.
So, Dr. Yusuf, now it is for you as an academy to take this initiative further whenever, because I think the entire region will be looking forward for this online course, especially. So, one last question before going back to Dr. Yusuf. Is there a minimum requirement for the applicant? I mean, for their AI competencies? Are they expected to be mastering using ChatGPT, any level of competency?
Absolutely not. You may have never touched AI. You're good to start. Okay. We are training people to understand how AI works from the ground up. Okay, so it doesn't require any fluency. What is sure is at the end, you'll be an expert as compared to everyone else, okay? And you'll feel totally in control. It's essentially, it starts by a driver lesson, okay? You may not need how the car works, but you know how to drive, right? So what we want you to drive effectively, not make accidents, not causing risks, understanding the limitation, but also where to focus the opportunity of using this technology for the years to come. Because listen, there's no doubt, there's absolutely no doubt that negotiators with AI will replace negotiators without AI. There's absolutely no doubt. It's in this context that we want to offer this to as many people as possible, the opportunity to acquire these skills and tools early, because it's really a matter of developing their own competences. So yes, you can join this course without having ever touched an AI model, and we'll be happy to work with you.
It is very reassuring. Dr. Yusuf, there is a question about the exam and research for the IAPH diploma and master degree, but I will rephrase it. How does IAPH link the student assignments, fieldwork to solve existing problems in their workplaces, institutes, etc.?
Yeah, actually, the curriculum, you can choose any program. The curriculum clearly state about the capstone project. The cap and the request for doing research, or not necessarily research, something that handling a priority area, one might conduct, for example, systematic review or scoping review, or maybe criticizing or doing rapid assessment, or doing that is relevant to the country. So the request, the capstone project has specific characteristics. The one should work in his or her own country, address a priority problem under and mentored by a specialized person. So those who are working on their capstone project will be, aligned, or they will be matched with specialized mentors, maybe in their countries or other countries, who can provide them with the supervision until they finish their project. They might work on a problem to solve, not necessarily research, maybe to work to develop specific protocols or guidelines. So there is a variety of activities to fit what country needs and what the health system needs.
Perfect. I think we have only 5 minutes before conclusion, but I really thank you so much, Claude, to Yusuf for this very interesting webinar. It is our pleasure to have you with us this evening here in Amman. And we are looking forward for our audience to see at least some of them joining us here in Amman for the course in July. And I'm sure that our team here will also share with you the links and other promotional materials that Claude kindly shared with us in this session. And we are looking forward to see more collaboration between the International Academy of Public Health, EMPHNET, and University of Geneva, not only in this course, but many other coming courses, especially in those kind of areas that are really needed in our region. So I really thank you. And Claude, you have 1 minute to conclude. Any final words?
Well, simply to say, I've worked in the Middle East for many years. It was very close to my heart. In North Africa and all the region you're working in. I lived in Saudi Arabia. For me, it would be a privilege working with professionals from the region. This is on these professionals depends a lot of good effort in public health in the region. And therefore, it would be an honor and a privilege to collaborate with EMPHNET and the International Academy of Public Health. And I look forward to meet participants in Amman in a month. Thank you very much.
Thank you, Dr. Yusuf. Thank you, Dr. Yusuf.
Yeah, thank you, Dr. Haytham. I'd like to say that IAPH will continue committed to advance public health education and professional public health education in the whole region. We are very willing and supportive to strengthening public health system in the region through our capacity building initiatives. Thank you so much.
Thank you. Thank you, Dr. Yusuf. Thank you, Claude. Thank you, our participants and our organizing team, Dana, Mais, and Ammar. Looking forward to see you in our next webinar, inshallah.
Thank you.
Right.
Thank you.
Thank you all. Thank you all.
Thank you.